So talk to us about these common conditions that cause neck pain.
So disc herniation is the more serious one. Disc herniation is when a disc herniates out and starts touching the nerve, and then you get that radiating pain that we were talking about earlier. Stenosis is a very interesting thing. It happens as we get older. It can actually happen from a disc herniation, but it usually is a result of arthritis, and that's a narrowing of the canal. The important consideration here is that when you narrow the canal, the spinal cord's in there, and if you start touching your spinal cord, that could affect things like balance, bowel and bladder control, hyperreflexia, just being not coordinated well, and that's a very serious condition and can be a very surgical condition. Spondylosis is just a fancy word for arthritis. So it could affect your discs or the small joints in the back of the neck or the entire spine for that matter.
And can that turn into degenerative disc disease?
Absolutely. So degenerative disc, the disc is the cushion between the bones. It's very important to have that. As we're younger, it's nice, soft, and spongy. As we get older, it loses its hydration and it can crack and it can herniate. So that's something to consider. A fracture is definitely very serious in the neck. People know the common hangman's fracture. That's a fracture of the C2 vertebrae. But any fracture due to trauma is a very serious condition in the neck and often requires surgery. Or some people can get away with bracing, but it's really, it depends on which vertebrae is fractured, how it's fractured, but it's usually a very significant emergency. Bone spurs are a result of arthritis. So that spondylosis term we saw, bone spurs occur during lines of stress, and they can start pushing on the nerves as the spur gets longer and starts compressing the nerve, then you get the radiating pain.
Now, is there a specific age group that these disorders affect the most? Is it genetic? Is it age?
There definitely is a predisposition in genetics. They did studies, Danish researchers did studies on twins, and they used 15,000 twin studies looking at genetics, and there's definitely a significant genetic predisposition to degenerative disc disease.
Wow.